The 7th International Workshop on Waldenstrom's Macroglobulinemia and Symposium on Advances in Multiple Myeloma was held in Newport, Rhode Island. This was the meeting where genomics played a central role both in Waldenstrom macroglobulinemia pathogenesis and treatment. Mutational studies were reported that demonstrated the importance of MYD88, and treatments, which were nucleoside analogs and rituximab at the time, were now shifting to BTK inhibitors related to targeting related signaling. The role of accessory cells and cytokines in the microenvironment were also highlighted. It truly was a paradigm shift, both in the biology and treatment, that continues to this day. Some memorable events included multiple lively debates, two of which were survival in Waldenstrom's macroglobulinemia. Are we making progress? Yes, by Dr. Christensen, and no, by Dr. Demopoulos. It's an overwhelming yes, as you know. And the second debate was on autologous stem cell transplant is dispensable in myeloma patients in the era of novel agents. Yes was Dr. Fremond, no was Dr. Barloghi. As you know, transplant is now improved with the incorporation of novel agents, and this debate continues. These workshops continue to advance progress in Waldenstrom's macroglobulinemia by three things: presenting cutting-edge science, bench to bedside, developing consensus on diagnosis, prognosis, and response criteria, and assuring that we have cross-fertilization with related diseases, lymphoma, myeloma, amyloidosis, to fast-forward progress. 12 years ago, we could never have dreamed of the many advances that have occurred, enhancing both our understanding of pathogenesis and the development of targeted therapeutics in Waldenstrom's. By fostering collaborations of scientists, translational and clinical researchers on the one hand, training the next generation of caregivers and researchers on the other, the International Workshop on Waldenstrom's macroglobulinemia has been integral to all these advances. And importantly, Waldenstrom's macroglobulin patients around the world have been and will be the heroes and motivation for continued progress at these workshops in the future.
Hello, I'm Nikhil Munshi from Dana-Farber Cancer Institute at the Harvard Medical School, and I am going to discuss the 7th Waldenstrom workshop that happened in Newport, Rhode Island in the United States. This was a very memorable event and a workshop, and there are many reasons. A non-technical aspect would be the grandeur of this place, the incredible buildings, and it was probably one of the best meetings ever from organizational point of view and various aspects that we also cherish and remember. But even greater importance was the content of the meeting, which is the heart of the meeting. For any meeting to be successful, it's not the place, it's the people and the science we discuss. And why is this meeting so memorable? Because it was the first meeting, Waldenstrom focus, where Dr. Steve Treon himself presented his really practice-changing finding that MYD88 mutations are central to the development of the disease. Soon after the meeting, or right around, it was published in New England Journal, and it has changed the biology of Waldenstrom macroglobulinemia. It has changed the therapy. It has changed the patient outcome. And in last 10 plus years, what we do today is very different than what we did then because of what was presented and discussed at the meeting. This was the meeting where Professor Morel was recognized for his great contribution, and Professor LeBlanc Veronique was recognized with Waldenstrom Award for her contribution in this field. And these are two very important researchers and clinicians who have contributed immensely to this meeting. And finally, this meeting paved the way for the new generation of leaders and new generation of scientists to begin to focus on Waldenstrom. The workshop that we are in today has come from the leaders that came from the previous workshops and previous engagements. And in that regards, so many of the newer investigators presented in that meeting who are now leaders in the field who are contributing even more. So in that regards, the meeting in Rhode Island was phenomenal in exciting the interest. And what would be a message that I would give to the young investigator? And that was very clearly highlighted in the Newport meeting: perseverance. Continue to pursue your ideas. It can lead to discovery of MYD88. The second one is believe in yourself. If you see a finding that looks believable, pursue it further. And finally, I think hard work. What Dr. Treon and his group presented was incredible hard work that led to this new finding. Thank you.